USMLE style question. A 54-year-old woman with a history of hypertension and smoking presents to the emergency department with a sudden, severe headache described as the worst headache of my life. She also reports nausea, vomiting, and neck stiffness. On examination, she is conscious but confused, with photophobia and mild nuchal rigidity. A non-contrast CT scan of the head reveals hyperdense blood within the basal cisterns and sylvian fissures. Which of the following is the most likely cause of this patient's condition? A. Ruptured saccular aneurysm. B. Ruptured middle meningeal artery. C. Ruptured bridging veins. D. Hypertensive intracerebral hemorrhage. E. Cerebral amyloid angiopathy. Answer and explanation. Correct answer, A. Ruptured saccular aneurysm. This patient presents with a subarachnoid hemorrhage, SAH, which classically presents with sudden severe thunderclap headache, worst headache of my life, meningeal signs, neck stiffness, photophobia, nausea, vomiting, altered mental status. Most common cause, ruptured saccular berry aneurysm, often at the bifurcations of the circle of Willis, particularly anterior communicating artery, ACOM. Most common, posterior communicating artery, COM, CN3 palsy, ptosis, mydriasis. Diagnosis, non-contrast CT, blood in the basal cisterns or sylvian fissures. If CT is negative but suspicion remains, lumbar puncture LP showing Xanthochromia. Confirm with cerebral angiography. Complications, rebleeding, first 24 hours, increased mortality, vasospasm, 3 to 10 days later, delayed cerebral ischemia, prevent with nimodipine, hydrocephalus. Incorrect answers. B. Ruptured middle meningeal artery, causes an epidural hematoma, not AH, associated with skull fractures at the pterion and a lucid interval before deterioration. C. Ruptured bridging veins, causes a subdural hematoma, typically seen in elderly patients, alcoholics, or infants with crescent-shaped bleeding on CT. D. Hypertensive intracerebral hemorrhage, affects deep brain structures, e.g. basal ganglia, thalamus, pons, not the subarachnoid space. E. Cerebral amyloid angiopathy, causes recurrent lobar hemorrhages in elderly patients, usually presenting as intracerebral hemorrhage, not SAH. Key learning points. Subarachnoid hemorrhage causes saccular berry aneurysm rupture, most common, AV malformation, trauma, symptoms, thunderclap headache, nausea, photophobia, neck stiffness. CT findings, hyperdense blood in basal cisterns, sylvian fissures. LP findings, Xanthochromia, yellow CSF from RBC breakdown. Treatment, endovascular coiling or surgical clipping, nimodipine to prevent vasospasm.